Hi, my name's Carly. I'm a student from St. Francis, and I'm just going to do a quick assessment over the baby. Before I get started, I'm going to check for the baby identification bracelet on its arm to make sure that it's the right baby, and it is. Good. And before I get started, I'm going to do a quick vital assessment, and I'm going to listen to the temperature, pulse, and respirations, and then I'm going to wash my hands before I get started. Okay? So I take the temperature, and then I'm going to listen for the heart and the respirations bilaterally for a minute. And then everything sounds good. And then I'm going to look at the baby's head, and I'm going to note if there was any molding, the suture lines, and the soft spots of the baby's head, and note any scratches or bruising from birth. If your baby has any swelling on the top of the head, it could be either caput succedaneum, and that is swelling with fluid underneath, and it goes over all the suture lines, whereas if you had the cephalohematoma, that would only be on one side of the head, and it does not cross suture lines. Okay, and then I'm going to come down, and I'm going to look at my baby's eyes, and I'm going to note that they are midline and that they're symmetrical, and I'm going to note any drainage or if there was subconjunctive hemorrhage, and then also note the epicanthal folds. And then I'm going to look at my baby's ears and make sure that they're in line with the eyes, and I'm going to fold them carefully and just to test for recoil, and that looked good there. Then I go down to my baby's nose, and I'm going to hold one side and put my finger underneath to test for if the nares are patent, and you can just feel if they're breathing, and that felt good there. And then I'm going to put on gloves, and I'm just going to rub my baby's cheeks so that they will go to it so I can put my finger in. I'm just going to feel around the top of the baby's mouth to note that the palate is formed and to feel if they do a sucking reflex. So everything was good there. Take my gloves off. I'm going to go down to my baby's neck, and I'm going to feel around for any masses, and then test for range of motion just real carefully, and that felt good there. Then I look at the clavicles, and I feel just to make sure that they are still intact, nothing's broken, because sometimes if you have a larger baby on the way out, they tend to break their clavicles. So just make sure that everything is intact there, and that felt really great. All right, then I'm going to undress my baby just to look at their skin real quick, trying to keep them warm. And I note the color of the skin, and I look for any birthmarks, bruises, scratches, lanigo, or birthmarks, or anything else on the baby's skin, and everything looked good there. And then I'm going to look at the baby's abdomen just to make sure that the baby's abdomen is round and nothing looks different there. And I'm going to listen to the bowel sounds before I palpate. And those sounded good, active. And then I'm going to palpate the baby's abdomen just to feel for any abnormalities, and that all looks good. And while you're doing that, you can look at the baby's chest and look to see if they're having any respiratory distress. And what you're looking for is retraction, which with the skin would go in between the ribs on the baby, and then grunting if they're trying to breathe, nasal flaring, seesaw, which is if they're rocking while they're trying to breathe, and then apnea greater than 20 seconds, because sometimes your baby holds their breath, but if it's longer than 20 seconds, that could be abnormal. So that all looked good there. So I'm going to try and cover my baby up. And I'm going to go down, and then we're going to look at the baby genitalia. So my baby is a boy, but I'm also going to note the girl baby as well. So on a boy baby, you're just going to look, and you're going to palpate with gloves on and make sure that their testes have descended. Then you're going to also look and note if there's any rugae on the scrotum, And then you're going to check to see where the urinary meatus is and make sure that it's not underneath or on top, that it's right on top. And then you also want to check to see if your baby is circumcised or not. And then if I was looking at my girl baby, I would want to make sure that the labia majora is covering the clitoris, and then it's typically darker on babies. And then you also want to know if there's any discharge or things like that. So my baby looks good. So then you're going to cover them back up. And I'm just going to flip my baby over real carefully. Have them lay on their belly. And you want to look at their spine, and you want to make sure that the spine is midline, that there's no abnormalities there. And then you want to look at the top of the baby's buttocks and see if there's any dimples or tufts of hair, because that could be a sign of spinal bifida. And that looked fine there. Okay. And then while you're doing your assessment, you want to watch your baby and see how it is reacting to how it's responding. You want to assess their emotions, and then you also want to do a test where you hit the table. It's called moral reflex, and their arms should go up in a C motion. So if this was a real baby, I would do that. And then I'm also going to look at my baby's hands and feet and check to make sure that they have 10 fingers and toes. And then I'm going to do the Babinski reflex, where you run your finger along the side of the baby's foot and all the toes should spread out, but this should only happen in babies. And then on my baby's arms, I want to hold my baby's arms up and then hold their arms down, and their reflexes should bring their arms up. And so you're just testing for muscle tone on that one. So that looked good there. And then for my baby, when I tested for their temperature, pulse, and respirations, I'm just going to list the regulars that a baby should have. So for temperature, their normal is 97.5 to 99, their pulse is 100 to 160, and their respirations is 30 to 60. So my baby was obviously in limits. And before I finish my assessment, I just like to talk to mom and make sure to test or to see when the baby last voided and last had a bowel movement. And then I also want to make sure that she's feeding him on a correct schedule. And it was all good there. Thank you. That was my baby assessment.